If you're past the age of 60, there's a seemingly harmless habit that could be quietly increasing your risk of a stroke while you're asleep. No warning signs, no pain involved. One moment you're perfectly fine, and the next, you find you can't lift your arm, your speech is slurred, or your balance is off. As Dr. Anya Sharma, I've sadly witnessed too many older individuals experience this. And it's not due to smoking, a poor diet, or lack of exercise, but rather something they believed was beneficial: vitamins. Yes, you heard that right, vitamins. Each day, countless seniors take supplements with the hope of safeguarding their bones, increasing their energy, or maintaining a sharp memory. And while many are indeed helpful, some, especially in high amounts or taken at the wrong time, can subtly put your brain at risk. Today, I want to guide you through 5 common vitamins that may elevate your risk of stroke, brain bleeds, or sudden spikes in blood pressure, particularly during the early morning hours when your brain is most vulnerable. If you've ever taken vitamin D, E, B6, A, or niacin, this video could potentially save your life. Before we get started, I'm curious to know, have you ever wondered if your vitamins might actually be causing harm? Type 1 in the comments. If you're interested in learning more, type 0 if this is completely new information to you. And if brain health is important to you or someone you care about, please remember to like this video and subscribe to Health 365 for reliable, science-backed advice created specifically for older adults. Now, let's begin with perhaps the most surprising one of all, vitamin D. What you don't know about it could turn a peaceful night's sleep into a dangerous situation. You've likely heard that it's beneficial for your bones, your mood, and even your immune system. And that's all true, when taken in moderation. But here's something most seniors are never told. Too much vitamin D, especially when taken at night, can quietly increase your risk of stroke. I realize that sounds alarming, but I've seen it firsthand with my own patients. Take Mr. Walter, for example, a 74-year-old retired Navy veteran. He was sharp-minded, disciplined, and took his health very seriously. Every morning, like clockwork, he organized his supplements, including a 10,000 IU vitamin D capsule he purchased over the counter. He thought he was protecting his bones. But what he didn't realize was that this simple routine was gradually leading his body toward a silent crisis. One morning, his wife discovered him confused. He was unable to speak clearly, and his right arm was hanging limp. A stroke, overnight. His lab results revealed dangerously high calcium levels, stiff arteries, and erratic blood pressure. The culprit was vitamin D toxicity. You see, when you take high doses of vitamin D, particularly without medical supervision, it causes calcium to accumulate in your bloodstream, and your body struggles to process all that excess calcium. So, it ends up depositing it into your arteries, causing them to become stiff and narrow. And can you guess where that can lead? A blood clot making its way straight to your brain. As we age, our arteries naturally become less flexible. Add in dehydration, poor sleep, and a surge of calcium at night, and you've created the perfect conditions for a stroke. The most frightening part is that there are no warning signs. You go to bed feeling perfectly well and wake up to find your life has been forever changed. And here's something you might not be aware of. Many over-the-counter vitamin D supplements in the US contain far more than older adults actually need. 5,000 IU, 10,000 IU. People take these every day, assuming that more is better. However, studies have indicated that even 2,000 IU daily may be excessive if you're not deficient. Let me be perfectly clear. If you're taking vitamin D, especially alongside calcium or heart medications, it's vital to have your blood levels checked regularly and always take it in the morning, not before bed. Do you know how many IUs your supplement contains? Type D in the comments. If you're currently taking vitamin D, let's start a conversation. And if this information has given you pause, please like this video to help others find it as well. Now, if that surprised you, just wait. The next vitamin is one that many people take for heart health, but in older adults, it can result in something even more dangerous than a clot, a brain bleed. Let's discuss vitamin E. Vitamin E, often touted as a heart health aid. If you've been taking it for years, you're not alone. Many individuals over 60 incorporate vitamin E into their daily routine, hoping it will support their heart, improve circulation, and perhaps even boost memory and skin health. But here's the information that doesn't appear on the bottle label. Too much vitamin E, particularly when combined with common heart medications, can increase your risk of bleeding in the brain. Yes, even if you're doing everything else right. Let me share a story I'll never forget. Mrs. Evelyn Brooks, 81, a retired librarian from Ohio. She was sharp, witty, and always had a book nearby. She had a heart valve problem and was taking warfarin, a common blood thinner. Her doctors monitored everything closely. Her blood work was normal, and her blood pressure was stable. But one day, she purchased a bottle of natural vitamin E she saw advertised in a magazine, 800 IU per capsule. "I thought it would help my memory and circulation," she told me. 3 weeks later, she was rushed to the ER with a severe headache, confusion, and vomiting. A brain scan revealed a hemorrhagic stroke, bleeding inside the brain. Not due to high blood pressure, not due to a fall, but because the combination of warfarin and high-dose vitamin E had made her blood too thin to clot. Just one fragile vessel in her brain ruptured. Here's what most people don't realize. Vitamin E in high doses acts as a natural anticoagulant, meaning it slows down clotting. If you're already taking aspirin, Plavix, or any other blood thinner, and then you add vitamin E, your risk of internal bleeding quietly increases, especially in the brain, where even a small bleed can rob you of your speech, your memory, or your ability to walk. And get this, the recommended daily intake for older adults is only 15 milligrams, about 22 IU. Yet, most supplements on store shelves contain 200, 400, or even 1,000 IU per capsule. No warnings, no consultations, and many people take them every day for years. Mrs. Evelyn survived, but she now walks with a cane, and her short-term memory was never quite the same. She told me through tears, "I just wanted to help myself. I didn't realize I was doing harm." And that's the part that breaks my heart, because she's not alone. So many seniors believe that if it's a vitamin, it must be safe. But the truth is, not every vitamin is safe, especially when you're taking heart or blood pressure medications. You must talk to your doctor before adding anything new. Now, if the thought of a brain bleed wasn't frightening enough, there's another vitamin people take for nerve support and energy that can quietly damage your nerves, sometimes permanently. Let's talk about vitamin B6. Vitamin B6, the one often labeled as a nerve support or brain booster. You might have seen it in those bottles at the pharmacy promising to help with energy, focus, or even memory. And perhaps someone even told you it's good for aging nerves. But here's what most seniors are never warned about. Too much vitamin B6 can actually damage your nerves, sometimes permanently. Let me tell you about Mr. Harold Jenkins. He was 76, a retired truck driver from Kansas. He came to my office because his feet felt numb, his hands tingled, and his balance was off. At first, he thought it was just age. Then he started falling. First once, then again. The third time, he hit his head on the bathroom floor. When I reviewed his supplements, I identified the issue right away. He'd been taking a nerve support formula for over a year. The label said it supported brain health and circulation, but inside each tablet was 100 milligrams of vitamin B6. And he was taking 2 tablets per day. That's 200 milligrams daily, over 10 times the recommended safe upper limit for seniors. Now, here's the scary part. Unlike some vitamins that are flushed out in your urine, B6 accumulates in your system over time. And in older adults, it can damage the protective coating around your nerves, like stripping insulation off a wire. The result is tingling, numbness, muscle weakness, tremors, and even confusion or memory issues. What's worse, the symptoms develop slowly. Many people think it's arthritis, aging, or early dementia, but it could actually be B6 toxicity, a slow, preventable kind of nerve damage caused by a pill intended to help. And it can be permanent if not caught early. Mr. Jenkins was fortunate. We stopped the supplement, and the damage didn't worsen, but he still uses a cane, and he no longer drives. He told me, "I just wanted to protect my brain. I didn't realize I was poisoning it." Let's be clear, vitamin B6 is important, but in very small amounts. Older adults only need about 2 to 10 milligrams per day, and that includes what you get from food. But many brain support pills sold online or in stores contain 50, 100, or even 200 milligrams. That's not just unnecessary, it's dangerous. So, if you're taking any supplement that says nerve, brain, or energy, Check the label, know your numbers, and type B6 in the comments if you've taken a supplement like that, or know someone who has. Now, you might be thinking, at least some vitamins, like A, must be safe. It's just for eyesight, right? Well, not exactly. Let's talk about vitamin A. If you're like most older adults, you've probably heard that vitamin A is essential for good eyesight. Maybe you've even taken it for your immune system, skin health, or because someone said it helps you age gracefully. But here's what almost no one tells you, especially if you're over 60. Too much vitamin A doesn't just sit quietly in your system, it accumulates. And over time, it can increase pressure inside your skull, mimicking a stroke, damaging your vision, and even affecting your brain. Let me tell you about Ms. Dorothy Simmons. She was 79, a retired piano teacher from Oregon. She loved music, taught students from her living room, and took pride in staying independent. But one day, she started experiencing headaches, followed by blurred vision, then dizziness and slurred speech. Her family feared the worst, a stroke. But when we ran her scans, something surprising appeared. No clot, no bleeding. Instead, she had elevated intracranial pressure, too much pressure inside the brain. Her spinal fluid was backed up, and tiny veins in her brain were under stress. The cause was vitamin A toxicity. She'd been taking a high-dose skin and eye supplement for over 5 years, nearly 10,000 IU per day, every day, without realizing it. Here's the key difference. Vitamin A is fat-soluble. That means your body stores it in your liver, your tissues, and even your brain. It doesn't flush out like vitamin C or B. And as we age, our liver slows down, so that buildup happens even faster. When there's too much vitamin A in the body, it can lead to a condition called pseudotumor cerebri, a false brain tumor. The symptoms include headaches, blurred or double vision, dizziness, nausea, and even permanent vision loss or cognitive decline. The tricky part is that many multivitamins already contain the full recommended dose of vitamin A, but some people, like Ms. Dorothy, unknowingly double or triple that by adding skin, eye, or anti-aging formulas on top. The safe upper limit for seniors is roughly 2,500 to 3,000 IU per day, and that's only if needed under medical supervision. But many supplements sold online contain 5,000, 10,000 IU, or more. Taken daily for months or years, it's easy to see how the damage accumulates. Ms. Dorothy is slowly recovering, but she now needs regular eye exams, pressure checks, and balance therapy. She told me, "I thought I was doing something good for my body. I never imagined it could hurt my brain." And that's why I share her story, because it's not about scaring anyone. It's about making sure you have the facts so you can protect yourself and your independence. Now, if you thought eyesight vitamins were risky, wait until you hear what happens when a vitamin meant for cholesterol and heart health suddenly spikes your blood pressure. Let's talk about niacin, vitamin B3, a vitamin you might have taken or been told to take for your heart. Niacin, also known as vitamin B3, is often praised as a natural way to lower cholesterol. Some doctors even prescribe it, and you'll also find it in heart health supplements, energy drinks, and fortified cereals. But here's what's often left out of the conversation, especially for older adults. Niacin in high doses can quietly cause serious swings in your blood pressure and even trigger a stroke. Let me introduce you to Mr. Frank Miller. He's 82, a retired postman from Florida. He came to see me with a strange mix of symptoms: hot flashes in his face, a pounding sensation in his chest, and dizziness that came and went every morning. His wife thought it was anxiety, and his son blamed it on his blood pressure meds, but the real cause was something no one had thought to check. Mr. Miller had been taking an over-the-counter heart-healthy supplement. The front label said, supports cholesterol and circulation, but the back revealed 1,000 milligrams of niacin per serving. He was taking it twice a day, which is 2,000 milligrams daily, over 60 times the amount most seniors actually need. Here's what happens when you take niacin in high doses. It causes your blood vessels to suddenly expand, which is why your face may flush or feel warm. But shortly after, those same vessels snap back and constrict. That sudden tightening can raise your blood pressure, stress your heart, and reduce blood flow to your brain. Over time, this yo-yo effect is like tapping a hammer on fragile glass. Eventually, something gives. Mr. Miller had what's called a transient ischemic attack, or TIA, a mini-stroke. His speech slurred for 2 minutes, then returned. He thought it was a fluke. I had to tell him the hard truth. His daily supplement, meant to help his heart, was quietly harming his brain. And he's not alone. Many seniors take high-dose niacin without even realizing it. They buy flush-free or extended-release forms online, thinking it's safer, but even those versions can still raise blood pressure, trigger atrial fibrillation, and affect blood sugar levels. Here's what you need to know. For older adults, anything above 50 milligrams of niacin per day should be used only under medical supervision. And if you have high blood pressure, heart rhythm issues, or are on medication, please check your labels. Mr. Miller is now off niacin, and he's recovering with no permanent damage. But he told me something I won't forget. "Doc, I thought I was doing everything right. I didn't know I was gambling with my brain." So, now that we've walked through 5 common vitamins, each with the potential to quietly harm the brain, you might be asking, what should I take instead? Or better yet, what should I eat? Let's talk about real food, the kind that protects your brain without the risks. By now, you might be wondering, if these vitamins can be risky, what should I do instead? It's a great question, because the truth is, your body wasn't designed to run on pills. It was built to thrive on real food, whole, natural, nutrient-rich food that your brain recognizes, absorbs, and uses in just the right amounts. Let me tell you about Mrs. Margaret Wilson. She's 73, a retired school principal from Arizona. When I first met her, she pulled out a drawer full of supplements: vitamin D for bones, vitamin E for heart, B-complex for energy, niacin for cholesterol, a multivitamin, and a few others for brain support. "I'm doing everything right, Doc," she said. But she was feeling dizzy in the mornings, her balance was off, and her blood pressure kept climbing. Something wasn't adding up. So, we did something radical. We cleared the clutter. One by one, we took away the pills and replaced them with food. No magic diet, no fancy program, just simple, whole foods at the right time in the right combinations. Here's what her breakfast looked like: 1 boiled egg for clean protein, half an avocado rich in healthy fats, a slice of whole grain toast for slow, steady energy, a handful of blueberries loaded with brain-protective antioxidants, and a glass of room-temperature water to hydrate the brain. Sometimes she added a few walnuts or almonds. That's it. No powders, no pills, just food, real, recognizable, nourishing. Within just a few weeks, Mrs. Wilson noticed a difference. Her dizziness faded, her blood pressure stabilized, and her energy returned. And she told me her mind felt clearer than it had in years. Here's why it worked. Your brain needs hydration, healthy fats, consistent fuel, and micronutrients in their natural form. It doesn't need mega doses, it needs balance. Some of the best foods for older adults include leafy greens like spinach and kale, rich in folate and antioxidants, fatty fish like salmon or sardines, full of omega-3s to protect brain cells, berries for polyphenol that reduce inflammation, nuts and seeds for vitamin E, magnesium, and brain-healthy fats, and whole grains to keep blood sugar stable and support circulation. And remember, these foods don't just protect your brain, they support your heart, bones, mood, and mobility, too. You're not just eating, you're healing with every bite. Final wake-up call. Awareness is the best medicine. At this stage in life, every choice matters more, and the truth is, it's not the pills you take, but what you understand about them that truly protects you. Your body at 60, 70, or 80 doesn't process supplements the same way it did decades ago. Even well-meaning habits like taking vitamins can quietly backfire if you're not careful. That's why awareness is your most powerful medicine. You don't need to fear vitamins, but you do need to respect them. Read the labels, ask your doctor, and listen to your body, especially when it whispers. If any part of this video resonated with you, tell me in the comments. What's one change you'll make starting tomorrow? If you found this helpful, please give it a like to help others find it, too. And please subscribe to Health 365 so we can keep learning, growing, and staying strong together. You're not alone on this journey, and you're never too old to take back control of your health.